Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Acute pancreatitis, and we're looking at the lab findings. So acute pancreatitis, it has elevated serum amylase and the serum peptidase. So there's increase in the serum amylase as well as peptidase. So increase in serum amylase and the serum peptidase. So what are the values? The values is the serum amylase level, it rises immediately. So the serum amylase, this value, it rises immediately. So there's an immediate rise, and it peaks few hours and returns to normal in 3 to 5 days. And it peaks in few hours and it returns to normal. So normal, it returns in 3 to 5 days. Next is the serum amylase level, it lacks specificity. The serum amylase level, it lacks specificity. And next what we have is the serum amylase level. They do not correlate with the severity of pancreatitis. They do not correlate with the severity of pancreatitis. Severity of pancreatitis. Next is the serum lipase is more specific. The serum lipase, it is more specific, and it is more useful when the patient presents with a 24 to 28 hours later, and it is more useful. So you're calling it useful if the patient presents 24 to 48 hours later. Next what we have is the hyperglycemia. So here there is hyperglycemia as well as the hypocalcemia. So increase in glucose and the decrease in the calcium. So hypocalcemia. Then there is also the hypoalbuminemia. Hypoalbuminemia. Next, what is there? There is leukocytosis, and there is elevated serum levels. So there's increase in the serum levels, and this is of the hepatic enzymes like the alanine aminotransferase, like the enzymes like the ALT, that is alanine aminotransferase. Alanine aminotransferase. Then what do we have? Next is the azotemia. There is azotemia. So here in azotemia, it is due to a prerenal acute renal failure. This is due to a prerenal acute renal failure. And this is in case of the severe fluid loss. This is in terms of the severe fluid loss. To learn and grow daily like this, please do subscribe.